Hello, my people. Hopefully, everywhere you are fine. I'm also fine from where I am. So today we are here to run. We are going to run something today, just a little tip of it, so that it can help improve our lives and the lives of others who are near us. So today I have something here. It's unveiled in a box. Let's go down and let's see what we are having today. So today we have something called Nicorette. Nicorette is used for those people who have problems with addiction. This is a solution. It's a solution. It's among the solution of those people who smoke, those who are addicted to smoking. That is cigarettes mostly. That is for cigarette most of the times. How is it looking like? It looks like this. It comes in a package. It's square in structure. Then it's white in color, and it is in a chewing gum form. This is a chewing gum, actually, by the way. So with me, I've got a piece just to see how it looks like, and let's go down again into it and how we see what can we do with this. So this Nicorette is used for those people who have withdrawal symptoms, those who are addicted to alcohol, not addicted to alcohol. Have this tendency of remembering some songs. There is this song that says, "I'm addicted to alcohol." Let's leave that aside. Okay. So this is incorrect. This is used for those people who are addicted to smoking, specifically cigarettes, which contain nicotine. Nicotine is the main component in the cigarettes. So what are the disadvantages of smoking? Every cancer is linked to smoking. Every esophageal diseases, they are linked to smoking. We have Barrett esophagus, we have cancer of the throat, cancer of the esophagus, cancer of the stomach, cancer of the mouth. We have all those cancers. They are linked to smoking. So those are some of the disadvantages of smoking. Again, it risks you to high infestation by this TB. That is why among smokers we cannot lack a smoker who has TB as one of his diseases. So now the researchers did something, and they thought, how can we eliminate this smoke? How can we eliminate all these adverse effects that are coming with smoking? Now, how can we help solve this? So they came up with a product with this product. It's called Nicorette. As we have said, it contains nicotine. It's a chewing gum. It's a chewing gum for smoking. Okay, this drug is used for those particularly who take more than 20 sticks a day. Those who smoke more than 20 sticks, that is the cigarettes, so more than 20 cigarettes a day. Those are people who are addicted, actually. Those people who cannot do it without smoking. So particularly for this one, this is 4 milligrams. It is 4 milligrams, has 4 milligrams of nicotine, and it's a chewing gum with fresh mint as its flavor. So this, how is it used, and who should not use, and how? So number one, those people who should not be using this, it is any child with less than 12 years. We said in Kenya we take 12 years of age as our now differentiating between an adult and a child in medicine. That is in medicine, but we know normally as per the constitution it is 18 years. So anybody below the age of 12 years should not take this, should not use this product at all, even a minute. You know why? This has many disadvantages. It also has its disadvantages and the side effects, and that's what we are trying to eliminate when we do that. So let me keep this box aside. How is this used? This is used as the same way you smoke. If you have that urge of smoking, you go take that one. It's called what? As a stick. You go take that one stick of cigarette. So the same you do to this. You take this chewing gum. When you want to smoke, you just take this chewing gum, and you don't chew it rapidly as we do for the other chewing gums. This one, you take it, you chew a little bit, and then you feel the mouth has you all feel that taste of nicotine. After you feel that taste of nicotine, what do? You just place it inside in between the cheek and your teeth. That's where you put it. You know why? It is to help with the absorption, because we don't want this drug to be absorbed rapidly into your body and to your system. So that's how you take Nicorette. How many times are you supposed to take this? The maximum number of times that you can use this product, it is 15. You cannot take more than 15 of these. Now how many are these? 1 2 3 1 2 3 4 5. This is the maximum that you can take in a day for those chewing more than 20, for those who smoke more than 20 sticks per day. So these are the maximum number of chewing gums that you can take with Nicorette. For those who have questions, for example, those for what about those who are pregnant? For those who are pregnant, they can also use this product. You know why? It is more advantageous to take this rather than taking the smoking rather than smoking the cigarette. You know, as you smoke the cigarette, we said it is corroding your esophagus, it's corroding your lungs, and there's deposition of tar, the black substance in that smoke. It is deposited in your lungs. So it's better to take this rather than smoke. That's even the main purpose of this. For those who are withdrawing, this can help you minimize your number of sticks that you smoke each and every day. For this one, it's not much expensive. You can get it in any pharmacy, get into any pharmacy, and this can help you. For those who are addicted, you also remember other helping aids that can help you avoid smoking. For example, if you just journal down and you say this will be how I'll be taking, and you minimize the number of sticks that you'll be taking. You also check how you take your food, and also check the triggers. You avoid the triggers that will trigger you to smoke each and every time. You can also decide, now this is my way, I'll not be smoking. Whichever way you see will work for you. For those who are addicted, who have gone even to the psychological support and you are still trying, you can use this as a replacement for your cigarettes. For those who smoke bangi, it is not used for bangi, it is just used for cigarette, that is those things that contain much of the nicotine. Yeah, today at least we have learned. I want to tell you one thing. Health is your wealth. You know, the moment that you get down in terms of health, you're not going to be in a good situation. So take care of your health. Remember also to dehydrate, and also remember there is no health without mental health. No health without mental health. So if you are addicted, that means you are having a disease, and addiction is a disease. It starts with habits, it goes to a level that you become addicted, that you cannot do without that anything that you are addicted to. Those who are addicted to phones, those who are addicted to smoking, addicted to alcohol, addicted to many things. There are many things that you can be addicted to. So take care, and take care of your health, and also take care of yourself. Take care of those who are near you and your family. Thanks, my people. Let's continue learning. Remember to subscribe, also like. You can also share with your other friends or members of the family. Thank you.